Hi everyone, this is Maham Khan and my program is Fluid for Life. Let's start with the background. The proposal is increased in fluid intake by elderly nursing home residents. Fluid intake of nursing home residents is well below the recommended daily requirement of 1500 to 2500 ml for a day. Suboptimal hydration results in susceptibility to problems such as dehydration, urinary tract infections, pneumonia, pressure ulcers, confusion, and disorientation. It also results in increase in morbidity, mortality, and overall hospital care costs. Dehydration is one of the 10 most frequent diagnoses responsible for hospitalization in the United States. Elderly individuals have a decrease in total body water due to loss in muscle mass, changes in the cells, less efficient kidney function, reduced thirst sensation, and decreased ability to gain access to fluids. The reason all the more for them to take enough fluids. Simplest technique to improve hydration status is to consume adequate fluids. The previous work was a cross-sectional study on hydration status of nursing home residents in Taiwan that stated that the nursing home residents, especially females or those fed orally, had a comparatively high prevalence of inadequate fluid intake. It is important to access periodically the hydration status of nursing home residents and adjust their fluid intake accordingly. Another study on the nutritional needs of the elderly in an institutional setting suggested fluid intake of 30 ml per kg body weight with 1500 ml per day as a minimum for older people. A study on fluid intake in institutionalized elderly showed that when the standard of 30 ml per kg body weight is used, underweight residents have unrealistically low fluid recommendations. The interventions that have been conducted previously have not been based on the health behavior theories. Coming to the theoretical foundation, this program is based on the health belief model that was developed by social psychologists in the 1950s. It is intended to provide a theoretical framework for health behavior interventions following the constructs of perceived susceptibility, perceived severity, perceived benefits, perceived barriers, cues to action, and self-efficacy. All constructs are utilized in this program proposal and all activities are planned around the constructs of health belief model. Coming to the perceived susceptibility, this refers to the elderly nursing home residents' subjective perception of the risk of acquiring dehydration assessed by a questionnaire and will be addressed by giving handouts to the intervention group, emphasizing the importance of drinking water and eating moisture-rich fruits and vegetables. They will be able to identify the risk of acquiring dehydration. Perceived severity is the elderly nursing home residents' feelings on the seriousness of going into a state of dehydration. The medical consequences like poor quality of life, urinary tract infections, hospitalization, and mortality. This construct will be addressed by the handouts, informative and interactive session emphasizing the ill effects of a dehydrated state. Perceived benefits. The nursing home residents' assessment of the value of engaging in increasing fluid intake to decrease the risk of dehydration. The course of action the resident takes in preventing dehydration relies on consideration and evaluation of both perceived susceptibility and perceived benefit, such that the resident would accept the recommended health action if it was perceived as beneficial. Perceived benefits would include improved hydration, well-being, and improved quality of life. Educational session will also provide information regarding the association between increased fluid intake and lower dehydration risk, and a decrease in occurrence of urinary tract infections. Perceived barriers to take action include lack of thirst sensation, large size, difficult to hold water cups, fear of incontinence, lack of provision of moisture-rich fruits and vegetables. These barriers would be addressed by a lesson plan given to the intervention group. The plan will help them recognize methods to counter their perceived barriers. They would be given information about their thirst indicator, how they can improve the bladder continence by doing Kegel exercises, and provision of small size, easy to hold water cups. Coming to the cue to action, it is the stimulus needed to trigger the decision-making process to accept increased intake of fluid. These cues will include water intake reminder cards, easy to hold water cups, handouts, fluid offering every 2 to 3 hours, Further, additional knowledge through the lesson plan may serve as a cue to action. Self-efficacy is the level of the nursing home resident's confidence in his or her ability to increase fluid intake. This would be achieved by a peer educator, a nursing home resident that has a good hydration status as evidenced by his food and fluid assessment. He would address the elderly nursing home residents and how they can improve on this behavior, and giving lesson plan to the nursing home staff on offering support to the elderly nursing home residents. This would increase their confidence in performing this proposed behavior. The hypothesis is the elderly nursing home residents who participate in a 12-week health belief model-based intervention will consume 500 ml of fluid more than the elderly residents' control group not receiving the intervention. The intervention aims to utilize education and interactive sessions to increase fluid consumption by targeting the perception of the benefits of increased fluid intake while also eliminating barriers. It is expected that the elderly residents in the program will have an increased knowledge and improved attitude towards increase in their fluid intake and consumption of moisture-rich fruits and vegetables after receiving the intervention when compared to a control group. It is also expected that the health belief model of behavior change and the self-efficacy will improve the residents' quality of life and overall well-being. It is a randomized controlled trial at Baptist Health Nursing Home and Rehabilitation Center in Scotia, New York. The program involves randomization of 50 elderly nursing home residents. A baseline survey would be done from information on the residents' charts regarding age, gender, weight, illness, medicines being taken, as well as questionnaire on knowledge and attitudes on perceived susceptibility, perceived severity, and perceived barriers. Fluid and food frequency questionnaire will be taken. Subjects will then be randomized using a computer-generated block randomization method into 2 equal groups. 25 elderly nursing home residents will be designated as control group, and 25 elderly nursing home residents will be placed into an intervention group. Sampling and recruitment plan will involve participants recruited on recommendation of the nurse practitioner who charts the residents' fluid and food intake. Also, willingness by the participants to be part of the 12-week-long program. The recruitment involves elderly nursing home residents with age 65 to 80 years, both males and females, free from acute illness, mobile and not on any fluid restriction, and they do not require any feeding assistance. A mini mental state examination would be done on all participating residents to check for the mental cognition. The exclusion criteria are age more than 80 years, incontinence, cognitive impairment, hypertension, and renal disease. The incentives for the participating residents include a grand raffle draw at the end of the program, and each participant will be given a personalized t-shirt with the participant name printed on the back. Coming to the methods, the main objective is increase in fluid intake to 1800 ml by 25 intervention group nursing home residents. Secondary objective is improvement in the knowledge about the importance of increase in fluid intake by 25 intervention group nursing home residents. The program will run for 12 weeks. The 25 elderly nursing home residents assigned to the intervention group will receive program intervention based on the program design. The program starts with the provision of educational and informative handouts to the residents. The handouts will show important points on intake of adequate amount of fluid and consequences of low fluid intake. These handouts will address perceived susceptibility and will be a cue to action. In the second week, the intervention group will also receive lesson plan on perceived barriers, which are lack of thirst sensation and fear of incontinence. The intervention group will be gathered in the activity room and will be presented water with lemon slices in small, easy-to-hold water cups. The group will be taught Kegel exercises to improve their bladder continence and would be given infographic on Kegel exercises. Provision of moisture-rich fruits and vegetables to 1.5 to 2 cups per day. These activities will help remove or minimize their perceived barriers. The residents will be offered fluids every 2 to 3 hours that will offer Q2 action to the resident throughout the 12-week program. In the second week, the nursing staff will be given a plan on how to support intervention group nursing home residents in achieving target behavior of increasing fluid intake to 1800 ml per day. The lesson plan will include a PowerPoint presentation and interactive session where nurses will share their experiences and barriers to ensure adequate hydration of the residents. The staff would be given demonstration of water intake reminder cards and how they will make the intervention group fill them. There will be suggested ways in order to improve hydration status of the intervention group. This plan will help in enhancing self-efficacy of the intervention group and will also provide cue to the action. In order to increase self-efficacy, a peer educator will be involved in sharing his well-being experience as a result of adequate fluid intake. The peer educator will be a previously admitted healthy elderly. The control group will not receive any of these interventions. They will be given the standard information, food, and fluid provision. Coming to the evaluation outcomes, the primary outcome includes behavior change, which is increase in total fluid intake to 1800 ml per day by 25 intervention group nursing home residents. Clinical change is improvement in hydration and overall well-being. Secondary outcome will be improved knowledge about the importance of adequate fluid intake. Both primary and secondary outcomes will be measured at the start of the intervention, at 6 weeks, and at the end of the 12-week program. A participant satisfaction survey would be conducted at 6 weeks and at the end of the program at 12 weeks. Coming to the evaluation instrument and analysis plan. The outcome of increased total fluid intake would be measured by the fluid intake frequency questionnaire at the start, at 6 weeks, and at the end of the intervention, and also by the bioimpedance assessment for total water at start of the intervention, 6 weeks, and at the end of 12 weeks. The statistical tests involved would be t-test, mixed regression. The independent variable would be time, and the dependent variable, the fluid intake. And the bioimpedance assessment for total body water would be statistically tested by the t-test. The improved knowledge about the importance of increased fluid intake would be measured with the questionnaire regarding importance of adequate hydration and consumption of moisture-rich fruits and vegetables, perceived susceptibility, severity, and barriers at the beginning, 6 weeks, and at the end of 12 weeks intervention. And the statistical test would be a t-test of scores. The third outcome of participant satisfaction would be measured by a survey rating satisfaction at 6 weeks and at the end of the intervention at 12 weeks. The scale would be from 1 to 10. And the statistical test would be a mean percentage correlation with change in fluid intake. Coming to the budget justification, the funding will be requested from New York State Department Office for the Aging, and the total budget would be $115,000, and it would be divided among program staff training, incentives, handout material, water cards, supplies, bioimpedance assessment monitors, peer educator session, and data questionnaire. The sustainability plan involves behavior change and self-efficacy that will enable long-term improvement in hydration and well-being of the elderly nursing home residents. Increased knowledge and ways to counter perceived barriers will ensure sustainability of this program. These are the references. Coming to the volunteer reflection, I volunteered at the Baptist Health Nursing Home and Rehabilitation Center. My program proposal made me do my volunteer work with the elderly population. First part of the volunteering was to work as a checker in the dietary section that is administered by a private company known as Slick. I had to check the items on the tray and match them with the individual resident ticket. The ticket showed any special diet, feeding ability, consistency of food, and menu items. The thing that surprised me was no water was served to the residents with their lunch trays. Second and third part of the volunteer work was assisting in activities like playing baseball, and I read chronicles to them. The elderly were very cooperative and engaging. I had a wonderful experiencing experience working with the elderly. Thank you for listening to my presentation and have a nice day.